Dr. Steven Kum. Steven, you're a KOL and a vascular surgeon from Singapore, and from what I understand, you performed the first in man study for LimFlow?
Yes, that's correct, Joe.
So if you could share your background with our audience and what drew you to pursue the LimFlow technology and select yourself to be first in man.
So I'm a vascular and endovascular surgeon by training. A lot of my practice is focused on critical limb ischemia. Very little open surgical work. My practice revolves primarily around common sense, or what I think is common sense endovascular devices and techniques that's not based on reimbursement, but based on what really works. On top of the endovascular component, I do a lot of wound care as a surgeon, as a vascular surgeon. And for me, words like complete wound healing and limb salvage actually mean quite a lot compared to an interventionalist who may be talking about patency and things like that. So I think my practice is quite a complete wound-based and revascularization practice.
And Roberto Ferraresi, also an interventional cardiologist, a KOL from Milan, and a well-known interventionalist. So if you can share your background a bit and your engagement with LimFlow.
I was an interventional cardiologist, but I started about 22 years ago to treat chronic limb-threatening ischemia patients. And it was absolutely something totally new for me, because in cardiology, we had those time guidelines and standard procedure, etc. All this stuff was discovered and invented by other physicians, and I was only an operator trying to do my best. But when I started to face chronic limb-threatening ischemia, it was a totally different field. We have no guidelines, no standard approaches. It was something like an artisanal approach. Every one of us in facing critical limb ischemia tried to do his or her best with some artisanal devices. For example, when I had to treat 22 years ago a 30 centimeters long anterior tibial artery, I had only 2 centimeters long balloons. So I had to inflate, deflate for 20 or 30 times. Today we have a totally different material. So slowly, year after year, CLTI became my first field of action, and I stopped to do coronary intervention. And today I perform only treatment of patients with CLTI. And so LimFlow for me was in some way the answer for patients that have CLTI but are no option patients.